Well, good afternoon, everybody. Good afternoon. Good afternoon to the people here. Good afternoon to the people there. So welcome to the 2017 Conversation with Staff. My name is Ruben Parrish. I'm your current president for Staff Council. And so I just want to welcome you. And this time when we get together every fall, that is a time for us to dialogue on current events, on dialogue on things that are happening at UH, and what Staff Council has done in the past or within last year, as well as what we're going to do, and then provide some resources as well for staff, especially if there's some new things coming up, so everyone has a chance to know what's going on, as well as at the end, give you a chance to dialogue amongst things that you want to talk about or have questions for ones who are here. So, to not delay anything and to make sure that everyone gets back to work and all. So the first thing is this right here. I just want to make sure that if you didn't have time, we'll probably put it back up here, a quick poll. This is something that we're trying to do, and I'll talk about that a little bit later. So if you haven't done it right now, you have a chance to do it a little bit later. So let me talk and get to, I don't know what I'm going to do. This happens. Yep, I did that. I did it. I know. So as they're working on this, because I think I just messed it up. So Staff Council, yes, that's me right there. Thank you. Normally I'm better than that, but hey, it's life. We just continue going. All right. There we are. Hey, how you doing? Conversation with staff. All right, so first thing and you may not be able to read it too much, but just quickly who we are. We're advisory body to the president, so we're here to work for you. That's pretty much what the Staff Council is, to take your concerns or complaints or whatever the case that you may have about what's going on with yourself, and we are presented to the university administration and others, and be able to be your sounding board for you, and then we'll be able to present to others. We like to promote a positive, meaningful interchange among staff, faculty, and students, provide activities, promote recognition, so we want to do a lot for you. As we get together and pull together as a team of your members on campus, the staff. But then we also have these 7 committees here, and these committees are made up of the staff members as well as ones who are not elected to Staff Council. So if you're one who is not with Staff Council, you're able to be on these committees. So if there's ones here that seem pretty cool or is interesting to you, or you saw events that we have put on, like Cougar First Impressions, and you want to be on that committee, you could be on that committee. Just send us an email. So we need a lot of bodies. We need a lot of people. We want staff to be involved. Yes, we have like 43, 45 elected members, but we have over 3,000 staff on this campus, and we can't do it all. And we can't, do everything that we want to do as much as we can, so having input and having help from everybody is a real cool thing to do. So what do we do, or what did we do last year? So I want to briefly go over a few accomplishments that we did last year with each of the committees that we have. So we have appointments, and so they appointed staff representatives to over 20 university-wide standing committees. So not only are we have our own committees within Staff Council, we are spread across the university. So we're on the TPAC, which is the Transportation and Parking. We're on Women's Gender Resource Advisory. We're on Food Advisory. So there's a lot of different committees that we're on that we try to put staff input in to help out and get your points across. Bring colleagues and thoughts and concerns to committees and reporting back to Staff Council. So not only do they go out and they attend these meetings, they bring it back to us so we can figure out what's going on and discuss some of the topics that come up to be able to make suggestions or recommendations so they could take it back. So we're trying to, talk for you all. Appointees also bring their valuable, diverse expertise. So not only we give the members a chance to go on to the committees that they will like. I mean, if they love food, they want to go to the food. If they love exercise, they go to the exercise one. So there's different committees that a lot of the members are able to go to. And so it's a really important thing when we do have it that we have that input. So if any of the committees that we have, if you have any input and you don't see some of us, or if you don't know your representative of your area, you can send an email to staffcouncil.edu or staffcouncil@uh.edu, sorry. So you can send your questions, concerns, complaints, wherever the case may be, and if it's something that you're seeing, we'll be able to get that email and take it over, especially if it comes to especially like parking, because parking is crucial. Parking, everybody likes to know something about parking. So if you have input, please let us know. Communications is another committee that we have, and last year we celebrate our 30th year on this campus. So we made a video, so the communications committee got together, made a video. We had a celebration as well here, and had a nice big cake. If you didn't get it, I'm sorry. But you get cupcakes today. They're really good. We try to hit the social marketing, so we got an Instagram account, and so we're trying to post and trying to do immediate information to a lot of you on this campus so you know what's going on. On our website, we are in the process of rebuilding the website, but right now the communications try to make it a little bit more user-friendly and put more information so staff would know what's going on. But now we're just restructuring a bit more so it'd be more user-friendly for everybody. As well as we put newsletters out there. I know you get so many emails, so many. And sometimes they just sit there, you just close them out. But the newsletters are pretty important for a lot of things that we are putting on or we want to get across to staff. Especially we have just like the poll you have up there, or you did have, we have post polls on our newsletters to try to find some more information out, just to gather some information out there from everybody. Our Cougar First Impressions, how many are involved with CFI? Woo, just about 10 of you, or probably everybody out there said, hey, good job. So CFI is our Cougar First Impressions, and as you see there, it's in the fall and as well as in the spring. In the fall, over 19 locations. Ice cream, if you didn't get the ice cream, it was really good this year. We have, as you're seeing, I'm not going to read it all, but it takes a lot, and a lot is given. And so there's several departments who give resources, give promotional items. We utilize those things to give out, and those all the free giveaways, and all the volunteers. So many volunteers have come out to help out, and they help out on multiple days, which is a great thing. So if you've never been part of CFI, please join this year. We have Spring CFI coming up. It is January. Somebody was just in the meeting. 17th? 16th and 17th, because it's a Monday and Tuesday, or 17th and 18th, something like that. So a volunteer request is going to be coming out, so if you want to volunteer, please do so. As you see there, 25,000 student questions answered. So if you're brand new or somewhat new to the university, this is a great way to get to know the university, because they're asking you questions that you may never thought about, and where buildings are and what's going on campus, and is a good way for you to learn as well. Membership and elections, this is a committee that helps build our memberships. And so one of the things that they had was our voters guide, both in English and Spanish for the first-time members, so giving everybody a chance to be able to read and know what they're voting for, who they're voting for, and extend it over the 3 weeks there, as well as they also had paper-based, I think, as well, for individuals who could not make it to a computer on campus somewhere. So we try to make it as easy and accessible for everybody to be able to vote. And this is a time around the springtime, if you know somebody who was thinking about being on staff council, you're able to provide their names so they could get on the ballot and be able to try to get on or elected to staff council. Other one, scholarships and professional development. So one of the big things with that is, as you see there, we provide a lot of different scholarships. One task for this committee here is doing the professional development to where we're trying to raise a bit more for that. So it'll provide y'all opportunities when you want to do that continuing education off campus or online or somewhere, that you'll be able to get reimbursed just a smidget, not reimbursed like $1,000 unless we get $1 million in there. So you might be able to, but that is one area that we're really trying to build this year, so we could get more money to allow y'all to get that continuing education that you may want for your certification, for your job, for you to get that promotion that you are overdue for. And so that's another thing there. We also renamed one the group, the first ever UH Group Award to Rebecca Swart Group Award to honor her. And so that is an award for presented to a group of or a department on campus that went above and beyond on this campus to do a lot of stuff. So professional, and then one of the things for professional development is having a bit more trainings on this year for everyone here. And if you have questions as I'm going, I know I'm just rambling on, but if you have questions, or a comment, you can just, y'all good, okay. One thing about Staff Affairs does a lot, and I'm not going to read this, but you can read it, but Staff Council is charged, and especially Staff Affairs is charged of looking at the maps and the SAMs. And so those are those policies that we have to abide by on this campus, or this campus is run by. So we are able to review those and give suggestions on how those maps and SAMs may be revised and better suited for the campus in general, but really looking at working for staff, especially if you look at number 2, flexible workplace initiative is one that was revised and now will be looked at again this year, just so we'll be able to utilize that a bit more, and managers and directors will understand this policy a bit more, so we'll be able to utilize it. A couple other things that Staff Affairs has done is they completed a Take Your Child to Work Day. I don't know if anyone in here participated or out there participated. It was a very huge success, and so we are going to be doing that again this year, and just look forward to that. We also put in a couple proposals to be able to, one, as you see, there's one-time bonus. I'm not going to get into that right now, so but it was submitted. If y'all want more money, budget happens. But we'll see. You never know what happens. And then the 15-year plaque to Rebecca Swart for her staff focus and 30-year anniversary celebration. So Staff Affairs does a lot. All the committees do a lot of things, and so this is just a smidget of what they accomplished and what they are doing. I mean, the staff here on Staff Council really work hard for all of you staff and all you out there. Every day, all day, especially when it comes to events where we need a lot of your help at times. A lot of you may have kids who love Easter eggs, candy. It's a big event for faculty, staff, and students to be able to, and the surrounding community. So we do an annual spring egg hunt. As you see, over 155, but we can have more. It's just having to have those individuals wanting to come help us out there. So if you are one who loves to do events, who love to be out there in front of everybody and help each other out, events committee is one that you can join to be able to provide this annual spring egg hunt, and possibly you could be the bunny if you want to, Mr. and Mrs. Bunny. It's a pretty cool job. You smile the entire time, and then your mouth hurts afterwards because you're just smiling. They can't see you smile, but it's an enjoyable time. Annual sock and blanket drive, we also do that, as you see there, to 3 organizations. So we always look around surrounding areas of Houston to see what organizations are in need. And so we provide new and gently used items as you see boxes going around, and that will be coming up within a month or so. And then we have the staff mixer at times, so we can all come together and talk and mingle and get to know each other, because we're always in our little silos all over the place. And we got to get to know each other. We got to get to know who we're working with, who are the new staff coming in, who's going to retire, where's the parties at, because those retirement parties are great. And so we have to know where those at so we can go. So events committee is a good thing, and they do a lot there. So where are we going, and what are we going to do? So briefly, I know it's a little small, but one of the things that we want to look at is doing more visibility of staff council. So anything and everything that we do is going to be staff council this, staff council that. So staff council conversation with staff council Cougar First Impressions, staff council is going to be out there. So hopefully you'll see a lot through that way, as well as wearing our shirts. So you know who your representative is within your department, so you'll be able to go talk to that person if you see them around. We're going to try to get our pictures taken and have placards. I don't know, we're stealing this from somebody, but we're going to have placards that say staff council, and they have their name, and put that in their window, cube, wherever they, wall, wherever they house that, and be able to have that on. So if somebody's walking by, oh, staff council right there, I could go talk to them because something just happened, or I have an idea. So getting us out there and visibility is one of the things that we want to do this year. Another thing is trying to establish that emergency fund. We all know a lot of people that may still be in need right now, or we may be in need that's in here from Hurricane Harvey and all. But then that's one time. It's over. Even though some people may still be in need, but then what happens in 3 months from now? Somebody else may be in need for something like kidney surgery or whatever the case may be. We want to establish a fund so faculty and staff will be able to apply to get some funding to help them out, because we want everybody to stay. We want to make sure that staff feel supported, faculty feel supported. So we want to try to have an emergency fund. Another thing I talked about was a flexible workplace initiative. I don't know how many people know about that, but it is there. And so we want to really look into how we can get that implemented more to the managers and the directors and say, hey, yes, you can work at home on a Friday or a Monday, and that could be your new schedule, whatever. And putting some stuff in, I don't know how it's going to work, but we're really going to talk about that and try to get that out there so we can get individuals who may have a position to where they have to stay at home sometimes, and they're able to do that, and they can restructure their schedule. Staff-only ombudsman. We had an ombudsman on campus, but we would like to have a staff only, because you want to go talk to somebody sometimes, right? Yes? Possibly, because you may not want to feel comfortable talking to your director or manager on some complaint or something, and you want to go talk to somebody. So we don't have an ombudsman, so we're going to try to get that established for all staff this year and get them hired, and so you have somebody to go talk to. There is a grievance process and stuff, but you want to go talk to somebody. And so if we could get that staff ombudsman, it'd be great. Another thing is continue reviewing and updating the maps and SAMs. And anyone can see it. Anyone can do this. You don't have to be on staff council to do it. All you do is go to that, I don't know what page it is, I don't know. But you go to the page and you'll be able to review and make suggestions on your if you want. But if you have some, you can always talk to us. Another thing is staff lounge. How many have you seen the faculty cafe? A few of it. It's pretty nice, huh? So faculty has somewhere to go. Where does staff get to go? Yeah, but I just got wherever. I go in my lobby of my office. Can somebody else come? No. So we're going to try to find a place on campus that staff can get together. So we could just sit down and relax and drink a little coffee or tea or water, whatever it is. I mean, if we get a space, it'd probably be just water because we won't have enough money for anything else. But at least we have a space so we can talk and congregate and get together and know each other a bit more, because we have to get out of our offices. We got to get out and reach out and talk to somebody and reach somebody. And then one of the last ones, this just happened today, that I was brought in on, is the UH Institutional Cultural Assessment Project. So what this is they want to assess the culture on this campus. What is our culture? Who are we? So there's two questions up there, as you see. One is, what is the culture of UH? So these two questions, I would like you here and who's watching us in front of your desk or at home, is to email your answers to these to staffcouncil@uh.edu about what is the culture of UH. And then if someone asks you about the culture of staff on campus, to finish the sentence, our staff have a culture of what? What is it? Who are we? What are we? So they're trying to figure out what is the culture on this campus. How can we talk about us and promote us to others and bring in other staff or other faculty on this campus. What is it that keep us here? What is that culture? What is that tradition? Whatever the case may be. But there's a project that's going to happen to where we're going to assess the culture. We're going to look at what's going on and see what we can do to try to implement something next year, starting in the fall. So it should be a very good project to figure out who we are, how we talk to individuals, how we promote UH, and how we are a Cougar on this campus. So that is my time. We're going to have time later on to have questions. But anybody have any questions or comments at this time for me? Yes, ma'am. We don't know yet because we're just in the planning phases. I just got on today. That was the first time I got there, but there is somebody coming in to help us with this project, and that probably will be in there. If not, I will bring it up. Yep. Anybody else? Yes, sir. I don't think so, but that is a very good idea. I know faculty is trying to do their own type of mentoring through their, is it launch? I don't want to say, but they may have one. But no, we haven't, and that's something that we share governance. We try to get together, and we do talk to faculty senate at times, so that could be something that we can look into. So thank you. Any other comments or questions? All right. Well, we're going to continue on to our next speaker, which is, thank you. To our next speaker is Breon Rollins from HR, and you just have to get to, you want to come do it, huh? All right, you got it.
Good afternoon. Just give me a moment to get set up, and we'll get going. Of course, I have to follow all the positive things that Staff Council is doing with benefit updates, but we'll get you taken care of. I'll make them as lively as we can. I can recall when I came and spoke with the group during a staff focus event back in the spring, some of these updates weren't to fruition yet. So it's good to talk about the changes that we've made so far, and then we'll give you some updates on how you can take most advantage of your healthcare plans that you have here on campus. So for those of you that I haven't met, my name is Breon Rollins, and I manage the benefits here on campus. We also have Courtney Stein with us today, and he'll be talking about some of the Power Up initiatives that we have going on. And I see a lot of familiar faces, and if you don't know where to find us, we're in 325 McElhaney, and you could always use me or Courtney, or it looks like there's a lot of HR folks here as well today as a resource. So let me get us going. So the biggest updates that we've been getting questions about here, specifically over the last 60 days or so, have been about the transition from United Healthcare to Blue Cross Blue Shield. And then we've also got a number of questions about a new vision program that started recently within the last year through the state of Texas. So today I wanted to give you all not only some details about those programs, but also information on how you can take best advantage of those programs as well. So there's two pieces of information that I want to start you all with. So our new transition that we just recently had starting 9/1, the United Healthcare program through Health Select of Texas became a Blue Cross Blue Shield plan. So how many of you all got your Blue Cross Blue Shield card in the mail, please, show of hands? Nice, because we had a few people who still haven't gotten that information, either a change of address or some information with the storm that had happened as well. And then if you've been with the Kelsey Care HMO program, there's been no changes with that program. So nothing has happened within the last fiscal year on that program. Everything stayed the same during this enrollment period here. So I want to go over a few details and some of the changes and some of the information that you can use for Blue Cross Blue Shield. One of the unique things that the state did as they went out for RFP and looked at the program was they tried to match what the value would be that we receive, not only with the pricing that we receive with our benefit program as well. Blue Cross won that bid at the state level, and one of the pieces that we were able to benefit with that is a program called Blue Cross Blue Access for Members. Now, I would imagine that you all probably remember when you had United Healthcare, if you went out and used a service, you may have received an EOB in the mail that talk to you about how much you may have owed for the service, what may be your portion, what the provider paid, et cetera. And then also you might have got some information on ways that you can reduce your cost and or plan for the amount of services that you might use throughout the year. Well, Blue Cross puts that all in a portal for us. So if you haven't had a chance to go out and visit, you'll want to go to Health Select of Texas, of course, and then you could use this long portal idea, but you can find it through Health Select of Texas, and you'll want to visit Blue Access for members. And there you can not only review your health coverage, but also the benefits that are available under your health coverage. One unique piece that I've enjoyed since we've had the Blue Cross, I'll have people that'll call and ask for, well, where can I find the provider for this or the provider for that? And we have had some limitations in the Houston area, and I'll talk about that here in a moment. But one piece that you can do is, let's say you're going for imaging or an MRI. Through Blue Cross, you can actually model what the cost would be, not only by value, but also by price. So you can look at the value of the provider, what the service level would be, they give it a rating of stars, and then also at the same time, you could look at what the price would be for that provider. So you don't get stuck at the doctor's office where the same provider down the road might charge $1,000 less with a better value on that. So that's one unique piece that Blue Cross Blue Shield offers as well. Another piece is all of your EOBs are in one place now. So regardless if you're using the Optum Rx provider or you're using the Blue Cross Blue Shield providers, all of that information is in one location. You'll have a profile on Blue Cross's Blue Shield website. You'll be able to log in and pull those details, and you can find all of that through the Health Select of Texas program. Many people have been looking at information as it relates to their provider, but I did want to give you some of the tools that were available first before we talk about the big issue, provider network and provider access. So any question before I go into the access and or network? Okay. So the biggest piece that I've gotten questions about, or we fielded questions about in human resources, is my doctor's not in the network, or my doctor may not be in the network after 12/31. And I would say that there has been some transition issues as it relates from United to Blue Cross. Keep in mind, Health Select still has over 50,000 providers in the state of Texas. Now, the issue, the narrow network became in the city of Houston, or the 5 surrounding counties in the city of Houston. And we've been talking with ERS, not only, the University of Houston has, but also the other agencies within in the Houston area have been trying to figure out ways that we can manage that process. So the first thing I want to tell you about is what's called a limited provider network. For those of you who use Kelsey as your primary care provider, you're still able to use Kelsey as your primary care provider, even with Blue Cross Blue Shield as your health care provider. Okay? To say that again, you probably remember back last year, we were having conversations about, well, will Kelsey be in the network? I use United, but I have a Kelsey provider that I've always wanted to keep. You can now keep that provider, but you would have to select what they call at Blue Cross a limited provider network. If you have any questions about that or don't know how to navigate it, come by and see us. We can assist you. There's a few of us in the office that'll make sure we get you set up correctly with that. With that being said, that's one of the networking issues that we were having in the beginning. Blue Cross is making those outreach efforts to try to grow and build upon the network. Kelsey was one of those first phases. They're working to add network providers. As I mentioned before, there's over 50,000 providers in the network. If you include Kelsey, you're at about 55,000. But if you have a provider now that's not in the network, you can actually nominate them to be a part of the network. Now, the nomination phase goes 2 ways. Your provider can attempt to join. There's some contracting and some credentialing that they'll need to complete with Blue Cross Blue Shield and the Health Select program, but you can also send a nomination form for your provider as well. At that point, the 2 companies will need to talk, your provider and Blue Cross Blue Shield. Now, the best outcome for that would be they credential, they choose to accept what the rate structure would be, and they join the network. If they don't, then that's where you may be in that situation where you need to look at some of the additional providers within the network. Some of you may have received letters from your primary care physicians that says something to the effect, we'll no longer be in the network after 12/31. Oftentimes, in my experience and in conversations with ERS, those letters are really just prompting you that there's still some negotiations happening in the background. Now, we can't make any guarantees that each one of your providers will end up in the network, but we do want to assure you that not only us here at the University of Houston are putting in nomination forms weekly. We know that you all are putting in nomination forms. We know your providers are having conversations with Blue Cross Blue Shield as well. The ideal situation is all of those individuals who receive the letter that their provider won't be in the network, by 12/31, a contract will be in place and they'll be in the network. So as I said, I can't come here and give exact news, but I do know that there are negotiations, discussions in the background that are happening, specifically of those of you all. Yes, please. I see a hand in the back.
Let's say that your doctor doesn't end up getting into the network, let's say January 1.
Correct.
Will Blue Cross pay to have our records sent over to a new PCP, or how is that going to work?
Yeah, so there's a couple different options. And to say the question again, well, what happens at 12/31 if my provider decides I'm not joining the network? So there's a few different things that can happen. One, if you're in a medical situation that requires some type of transition of care, you can apply for transition of care. So you don't immediately have to switch your provider if you're in a situation that requires you to continue on with that provider. Some illnesses or a second or third trimester pregnancy, things related to that will allow you to stay with that provider. Even if they do not accept the Blue Cross coverage, you'll still pay that in-network charge. You asked about your medical records being changed. Blue Cross Blue Shield is under the environment where they only like electronic medical records. So it's typically a relationship between the provider and your new healthcare provider. They would come up with the arrangements on how those medical records were transferred. If they're in a situation where it's not electronic, there usually isn't any cost incurred on the member, but there may be some cost incurred on your new provider to select those records. Any other questions? Okay, so another quick piece that I wanted to point out as well is the difference between what happens at the hospital and then the providers in the hospital. On the Blue Cross Blue Shield website, we've gotten a number of questions. Well, it says, well, MD Anderson is a provider as a hospital, or Kelsey-Seybold is a provider as a hospital, but when I go speak to my specific doctor, they say I'm not accepting the Blue Cross Blue Shield insurance. So you have to make note that just because your hospital or your facility is actually on the provider network, you need to speak to your specific provider as well. You need to speak to Mr. or Mrs. Doctor who's treating you, because you'll want to make sure that those individuals are actually in the network. Just because of the facilities in the network doesn't mean that the doctor's in the network as well. There's a comprehensive list. You can find that on Health Select Texas as well. And all you have to do is type in a zip code or the provider name, and it'll let you know exactly if they're in the network or not. And then the last piece that is a benefit that Blue Cross has made as well, mental health is a priority. I know Courtney will talk to you all here in a moment about the Employee Assistance Program. And then one link to that Blue Cross Blue Shield offers also is they have a wide mental health network, much wider than what we had with United Healthcare. And there's a number of ways that you can be sourced out or get information, and this is also benefits that you can use with your dependents as well. So if there's any need with that also, as we know that there was individuals who may be going through stress-related events from the hurricane or still in need, as Ruben had mentioned before, there's some additional assistance out there available for you all also through the Blue Cross Blue Shield network. So one other last piece that I'll point out, and I'm sorry about the graph. I didn't realize it would come out this green, so I apologize. But a new program that has been a part of our benefit program for a little over a year now is the State of Texas Vision Program. Under the Health Select benefit and under the Kelsey Care benefit, there are limited vision benefits. So for instance, if you have what I would typically call routine eye care, where you just go to the doctor once every couple of years just to check your vision, just to make sure that you don't have any issues, then this insurance program may not be for you. But if you wear glasses or contacts, which there are a number of us even in here that do, and I'm telling you right now, if I took these off, I couldn't see Ruben. So I'm wearing bifocals at this point. So the State of Texas Vision Plan is a plan that offers actual vision insurance that allows you to participate similar to what you would do on the healthcare side of benefits. So let me give you an example. Under our Health Select program, if you were to go to see a provider on the vision portion of it, you would pay a $40 copay. okay? With the State of Texas Vision Plan, that's a $25 copay. So you're already saving some dollars there. Also, let's say, for example, you needed glasses, but you needed new frames. With the State of Texas Vision Plan, you can get up to $150 towards those frames. It's a part of your benefit allotment. If you're covering yourself only, this benefit's about $7 a month. You already pay for itself in frames alone. You also get discounts as it relates to any type of level up that you would want on your lenses as well. Single vision, bifocal. We've also got progressive, polycarbonate, scratch resistant, et cetera. So it's a benefit that I've encouraged a number of people to look at. If you're what I would call non-routine, wear glasses, wear contacts, you're interested in having a new pair of glasses every year, this might be an option for you. And you can link a lot of these to a healthcare reimbursement account. You can set aside the money that you plan to spend throughout that annual year, and you can buy those glasses at each end of the calendar year as well. This benefit, the vision benefit portion of it, can be used multiple times, but you can only use the copays, et cetera, for that one time for the calendar year. So let's say, for instance, you've got 2 pair of glasses you would get. That's a total of $150. But keep in mind, unless you're buying major designer frames, sometimes you might be able to find a pair of frames for $150 that match your lenses, match your entire piece of glasses. So I encourage all of you to take a closer look at this as well. And I had some questions on that also. I think I saw a couple hands. So I'll start here. Yeah.
So for those of us that might wear contacts,
Yeah.
but yet need to wear glasses when we're not wearing contacts.
Correct.
I see the word "or." Can I use that 150 for contacts and glasses?
Yeah, so how they work that out is it depends on how the claim is. So this is a funny one. It's how the claim is processed. So if you're going in and you're purchasing frames, you can use it on the frames or the contacts. I encourage you to do it both at the same time, though, because you'll get that full 150 at that one point of purpose. So I wouldn't go at 2 different visits because that's when you'll run into the or. So that's how I do it. And I think I saw a hand here. Yeah. Yeah, so great question. With United Healthcare, when you would visit our on-campus provider, that $40 copay was waived. They're in the negotiation process now with Blue Cross to contract for that. My guess that won't be until the new year. So until then, I would always say support our on-campus providers. You know, they don't take the State of Texas Vision Plan, but we want to do what we can to support our on-campus providers. But if not, you could go out and only use the $25 copay at one of the facilities outside of the campus as well. Yep. But they are in the process of negotiating waiving that copay. We had some discussions about that a couple weeks ago. Yep. And I think I saw a hand here. Okay. All right. So that brings me to the end of my presentation. Of course, I'll hang around. I wanted to make sure that you all had details as it related to the change and the transition. Well, I'm not to the end. We got another question. Yeah. Yeah. Yep. Yeah, so there's 2 things that you should do, and this is if you're in the point of service plan Health Select. Make sure that before you leave, when they send you out for a specialist, that they check the network list. All the providers in Blue Cross, from your primary care side, they have a list of specialists that are also in that network. So if they send you to someone, make sure they send you to an in-network provider. Yep. Yeah, no, testing, you could do the same thing as well. Because remember, provider networks, they kind of work in groups oftentimes. But you can let them know, I only want my test sent to an in-network provider. You can do that at point of service as well. Good question, though. Anything else? Yes, please. I haven't been made aware that Kelsey was no longer, because there were no changes on the Kelsey side of Health Select. That'll be something I'll look into. I'll make a note of that. It was just only the Health Select through United where you were no longer able to use the on-campus provider. But I will look into the Kelsey for you. That's new information for me, but I will look into that. And the question was, as I mentioned before, we had the question about it. Well, if I went to the on-campus provider, I was able to get my copay waived. They accepted the Health Select plan through United. We had mentioned in the back that the same experience may have happened with Kelsey, which this is new information for me. So I'll look into that for you. And I'll get details back to Ruben, your group, and we'll vet that answer out for you all. Yeah.
Do you anticipate any changes in premiums and that sort as regards to what's happening on the federal level in order to push through?
Yeah, so the question was asked about premiums. Of course, we don't have all the information as it relates to rates and what they may look like going into the next fiscal year. Do keep in mind, though, that we're not linked to any of the Affordable Care Act information. So if there's a rating system, we're rated by the state of Texas, and we're rated by the ERS plans. So we're not linked to any of the information with the Affordable Care Act. So from what I've seen, we've been stable. And we've been stable to the point where at one point there was even some minor increase that was even reduced this fiscal year now. Again, that's not always going to be the case, but I don't anticipate anything that would happen to us as it relates to the rating that we receive due to the Affordable Care Act changes. Good question. Anything else? Well, again, I really appreciate you all allowing us to have this platform. I promise Courtney will talk about more things that are fun. You know, I'm up here talking about benefits, et cetera. But again, if you ever have any questions, we're in McElhaney, 325, and we can always be reached at 743-3988. And thank you again for your time. Thank you. They're next. Okay, so you want to use Courtney next then? Yeah. Okay, cool. Or are we going to go to Neil? Neil was on next. Okay, cool. I guess you get to be next. You're just the next slide down.
Okay, good afternoon. I want to thank the Staff Council for inviting me to speak to you today. I have a number of wellness initiatives I want to share with you, so I'll try and go kind of quickly, but if you do have questions, just raise your hand or we can answer those at the end. The first one I'd like to share with you is more information about our Employee Assistance Program. I talked about this last semester when we came to the Staff Focus event. I'm happy to inform you that it's now system-wide. We will now have EAP services across the system at all campuses, so that's a great benefit. And also, we've moved from the 2-session model to the 3-session model, which means now that you will have 3 counseling opportunities with the counselor and 3 opportunities with the legal consultation, and that's per issue. So that's a real great benefit for our employees. And of course, you'll have access to all the other life, work balance, fit topics and categories and information, everything from elder care to identity theft to health and wellness. The next thing I want to share with you is about our annual faculty staff ticket giveaway and tailgate for the football game against Memphis. So this past Friday, we had an event. We had cookies and punch, and we gave away tickets. 1 ticket per employee for a full-time eligible, benefits eligible employee. They were entitled to get 1 free ticket to the game, and we gave those out. And also, that's for our tailgate that will be coming up on the game day, October the 19th, this coming Thursday. So what I want to share with you, too, is that at the time, you were able to buy tickets together. You could buy extra tickets for $10 each. You can still do that. If you want to go buy tickets to the game, all you have to do is go online and use the code, that's a mistake, FSCOOGS, my fault, FSCOOGS. I'm going to be sending out a newsletter or an e-communication that'll have this information in it. So you'll get the link to go to, and you'll also get the correct code so that you can buy $10 tickets to the game. Prior to the game, we're going to have our tailgate. It's 4 to 7, Thursday, October the 19th. There's going to be free food, free drinks, free libations, free swag, and there'll also be free T-shirts for the first that arrive on a first-come, first-served basis. So the employees will be entitled to that with their UHID, and it's one T-shirt per employee. Also, to enter the event, you have to have your UHID. And to drink alcoholic beverages, you have to have your driver's license or a photo ID with you as well. Okay? Also wanted to let you know that if you weren't able to make it to the event this past Friday to get your one free ticket, you can do so today. After this event, we'll be here, and if you have your UHID, we'll be happy to give you your free ticket to the game. Coming up very soon is our Houston Corporate 5K. So this is a great opportunity to get some exercise and socialize with your colleagues outside of the office. What's unique about this opportunity is it takes place over the course of a week, from Monday, October 23rd to Thursday, October 26th, and you can participate anytime between the hours of 4 and 8 p.m. So it's really unique. You can go to work and then you don't have to worry about being late. You can get there whatever time your schedule allows and participate. And you do not have to run, so you can walk it. Get a group of friends, colleagues together and go walk the route, get in your exercise. Afterwards, at the post-race event tent, there'll be free treats and alcohol and beverages. And if you sign up today, today's the last day that you'll be able to get an event T-shirt, a free event T-shirt. There'll be goodie bags at the post-race tent afterwards as well. So for the first 50 employees who enroll here at the university will pay 50% of the entry fee, which is $40. And presently, I checked this morning, we're at $44. So there's still an opportunity for you to only pay half price for the entry fee and still get your T-shirt if you register today. So I'd encourage you to do that. It's going to be a lot of fun. We're happy to participate in this event, and I'm hoping that we can make it an annual event that we sponsor and participate in every year. Also, I will pick up everybody's packet for them, so they'll be here available on campus next week, so you won't have to go pick those up on your own, just to make that a little bit easier. Coming up is flu season, so we're going to have no-cost on-site flu shots available for employees. We will have HEB out as we did last year, and this will be on October 25th from 11 to 2 in the Space City room of the Student Center. If you have Blue Cross Blue Shield, it's covered at 100%. You just need to bring your pharmacy card, your Optum pharmacy card. You'll have to sign a waiver, fill out paperwork, but then you can get that along with your photo ID, your card and your photo ID, you can get your free flu shot. We're also in the process of working with Kelsey Care to have them come out and have a joint flu clinic at the same time. I have that almost nailed down, I think, but I'm going to say it's tentative for now, and if we are able to confirm it, I'll certainly send that information out because we'd love to be able to do that as well. The difference with Kelsey Care is that they're going to require your medical card, your medical insurance card, and your photo ID for that. Very soon, we're going to have on-site mobile mammograms. Breast Cancer Awareness Month is the month of October. These will take place on November 7th and November 8th. We have contracted with the Rose, a breast health organization in the community, to come on campus in their brand new state-of-the-art mobile unit, and they will be providing 3D or 2D mammograms. This will take place on 2 different time schedules to allow people to come again at whatever time fits their schedule. And it is covered 100% for those with Blue Cross Blue Shield. If you have another insurance, they may take that as well, and you can go online and find out. They have a list of all the plans that they accept. Unfortunately, Kelsey Care is not one of those, so we encourage Kelsey Care members to go to their own personal physician and schedule their mammogram and have that done. The exams take about 17 to 22 minutes. You can register online. It's fairly easy, and we'll be sending this information out via email very soon as well. So lastly, I want to talk about some ongoing and upcoming events. So ongoing, we have mindful meditation. If you've never participated, this takes place in the Wellness Center located in the Campus Recreation and Wellness Center classroom, and this is available every Thursday from 12 to 1, and typically for the first 15 minutes you get instruction on what it means, mindfulness meditation, and then you put it into practice for the next 15 minutes. It's a great opportunity to de-stress, relax, get outside and walk to the center and walk back, so I'd really encourage you to participate in this. It's going to take place all semester long. Also taking place are our public art tours. This is through the Outdoor Art organization here on campus. They're providing walking tours on the first, I think it is Friday, 12 to 1. You can actually find the schedule and the list of dates and times on their website. So I want to encourage people to take advantage of that, especially right now. The weather is so great. Great opportunity. Also wanted to mention about the UH Farmers Market. I'm going to let my colleagues talk about that, but wanted to let you know that we had introduced Farm to Work not long ago. It was successful. We enjoyed working and having that program here on campus. But with the advent of our Farmers Market, which is going to provide a greater array and variety of products, we have simply transitioned and are lending our full support behind that program. And actually, our farmer is one of the vendors at the Farmers Market. So we're excited for them and excited about this new market on campus that you'll learn more about in a moment. Coming soon. So we have our Lunch and Learn Wellness series taking place. Our very next one is October 17th and October 19th. If you'll notice, October 17th will take place at the Energy Research Park. And that's how you can register. You see on the slide. The one here on campus on diabetes will take place this Thursday, 12 to 1 p.m. We'll have a doctor from Kelsey C. Boyd talking about diabetes. Should be very interesting. I'd really encourage you to go online and register. We'd like to have a nice audience for him. Then after that, we'll have hypertension. Again, one at the ERP, and then one here in this very room at the library on the dates that you see. We're also working on a retirement session, an all-day series of workshops. Learn what you need to know. Presenting will be TRS and ERS coming in from Austin to provide information and answer questions. That'll be all day from 9 to 3 on November 3rd, and more information to come. Also, up and coming is UH Diabetes Wellness Day. This is going to take place November 14th, half a day from 12 to 4. It'll take place in the University Eye Clinic, and several partners on campus are coming together to provide this. There'll be free screenings, counseling, and education, so really encourage you to participate. And again, we'll send out more information. And then lastly, our Money Matters Financial Wellness Series wraps up. We had a series of 7 presentations. The last one will be November 29th. That'll take place here in this room with TDECU presenting Managing Credit, and they'll also provide lunch. So please go online, look at our website, find out more information, and also please read your emails. Hopefully I'll have a newsletter coming out tomorrow or one day very soon this week that'll have much of this information listed in it. Thank you. Any questions? Okay, thank you. Do you know, Ruben, do you know how? I don't know. Oh, escape. Should be at the bottom.
There we go, I see it.
Good afternoon, everyone. There you go. I'm Neil Hart. I'm the Executive Director of Auxiliary Services. For those of you that don't know, Auxiliary Services covers dining, cover parking and transportation. We cover the bookstore contract, the vending contract, the pouring rights. We have a couple of leased locations in McAllister's and T-Licious. So as part of our overseeing of the food services contract, this July, we transitioned to Chartwell's Higher Education. Here I have brought with me is David Riddle. He's the food service director of Chartwell's, and he's going to walk you through the changes.
Thanks, Neil, and hello, everybody. I'm relatively new to campus, started on July the 1st here, and we're really glad to be here. So thanks for inviting us. All right, first up, some things that's new on campus. One of the biggest changes is that Moody Towers is now 24/7. So students have a place to eat and hang out and socialize 24 hours a day, 7 days a week. And that's a nice new benefit for the residential population on campus, or really any meal plan holder on campus. We've also got all of our menus online. So this helps, all nutritional content is there. It integrates with Fitbit if you want to kind of do calorie counting and that sort of thing. But you can also sort by the food type. So if you're vegan, you can kind of see everything on the menu that day that's vegan with a couple of clicks. And gives good access to what's available. And then on the retail side of things, this year, students have the ability on most of the meal plans to do a retail exchange, so they don't have to take all of their meals at in Cougar Woods or Moody like they had to before. This allows them to go out into the Student Center or the Student Center satellite and enjoy many of our retail brands. We've also started serving breakfast at Chick-fil-A, you might have noticed. That's been a big hit. And we also took an old burger concept down at the satellite and turned it into Drexler's Barbecue. So please check that out. And then we also rebranded the convenience stores from what they used to be called a pod concept to the market at each location across campus. Something else we've piloted here on campus is an online ordering app called Boost. If you haven't tried it, it's great. You don't have to wait in line. You just show up at your designated time. You walk straight to the front. The food's ready, and it's kind of a fun experience when there are 40 people behind you waiting, and you get VIP treatment. So, and then we sort of thrive on feedback from all of our guests, faculty, staff, students, anyone dining with us. We want to hear from you. It helps us perfect our work every single day. So we have something at Moody and Cougar Woods. It's called Happy or Not. We've had over 65,000 people participate incredibly since we rolled that out. And it's just a simple push of the button if you had a good experience or a bad experience. But the nice thing about it is we get to see it hour by hour throughout the day, so we kind of know where we might have trouble or opportunities, as they say these days. But overall, so far we're trending at about 93% positive, which we're very happy about, but always looking at those times of day when we know we can do better. And then something that's goes out to all of the management team here on campus is called Chatback. And you'll see these on table tents. In retail, you might see a poster by the wall. Each location has their own number. It's anonymous. You text us whatever you're thinking, good, bad, and then we are able to react to it very quickly. And it can be something as simple as, hey, this cashier was really friendly, or it could be something like you're out of ketchup. And we were able to react to it immediately because it comes to all of our cell phones in the form of a text message. We have a great commitment to sustainability here on campus. One of them is zero waste to landfill by 2020 at Moody and Cougar Woods. And then we've also we're in the process of introducing our hydroponic gardens at Cougar Woods to take advantage of some of that beautiful natural light that was designed into the space. So we have 2 grow towers. And then that's the director at Cougar Woods, Jonathan Miller, standing in our compost bin. So we're also scraping all of our food scraps, post-consumer waste, so anything that a student doesn't eat on their plate, we're able to capture. We take to a local composting facility, and then it comes back as topsoil. And then we mentioned already the farmers market. This has been fun. We started out with 6 farmers and growers and local producers, and we're up to 11 at our last one, and we expect it to continue to grow because the response has been fantastic. The growers and the producers are really happy because they're selling out, they're making money, and bringing some new variety and things like that to campus. So if there's anything particular that you want to see, let us know, and we'll try to find somebody local who's doing that. We're certainly trying to add a baker for our next farmers market, so you can grab a loaf of French bread or something like that on your way home. We've rebranded catering on campus. It's called Fresh Fork, and does the full range of simple things like a breakfast to upscale luncheons, cocktail parties, receptions, that sort of thing. There is an online ordering mechanism, or you can always just call the office. And we're trying something new here on campus, which is a cashierless convenience store. So one of the challenges is always, sometimes in the evening, there's a real dip in customer traffic, which makes it hard to justify having somebody there to attend a location. But there's still a need because there may be 50 people in the building who do need snacks or a cup of coffee. So we're piloting over at ERP something called the Avenue C, based a little bit on the honor system, but it also has some surveillance cameras associated with it. But it basically allows you to come in 24/7 or whatever the building hours are, grab whatever you want off the shelf, and it's just like going to the grocery store to use self-checkout. But again, that's an effort to really expand service hours on campus and just make sure if people need nutrition, they've got it conveniently. And then on the horizon, looking forward, more new and updated options and variety, especially in retail. We are in the planning phases of what will replace Chinese Star. First of all, the building has to disappear. So first things first. But once that's gone, because it's not usable anymore, we'll look at what comes to replace it. There's also going to be an avenue, see this cashierless model I was mentioning in the law school. And that should open by January. And then lots of national brand refreshes. So if you see the Starbucks here on campus that doesn't look quite as up to date as the one you see in your neighborhood or the one you like to frequent, those are coming. We'll be bringing all of the national brands up to the current standard. We're also trying to push Boost to get more and more users on the online ordering kiosk, and then looking at additional breakfast options at Chick-fil-A and then at other brands as well. And with that, I'll entertain any questions for me or Neil. Yes.
Will the Starbucks on campus ever speak to the Starbucks nationally?
You mean the app? Right. I don't know the answer to that. We were able to get the gift cards, to be able to take gift cards this year. So that was our first accomplishment. And we've got questions out about whether or not we can take the loyalty app.
I know you can pay with it, it just doesn't reflect in your stars.
Right. Yeah, the question is whether or not they extend that to licensees, because we're a licensee, we're not a corporate store. So that might be the wrinkle there. I've got a question in the back. Okay, great suggestion. Thank you. Mm-hmm. So a two-part question. How do we compare to other peers in higher ed, and then what's coming, or kind of where are we going after the first year, I'm assuming. So Chartwells operates in about 280 colleges and universities across the country. I would say not many of them have 24/7 service, so I think that's something that's unique and a differentiator. University of Houston is the first to roll out Boost, so we're really making a big push here on this campus for mobile ordering and just technology in general to sort of simplify and expedite the food service process. I think those are two unique things. Certainly, we've got a commitment here. It's a system-wide agreement, so the contract covers all 5 campuses that have food service. So I think that gives us a unique economy of scale that we may not have at other single campuses. So we're treating this very much like a district. So I have additional resources that you normally wouldn't get it with a single account. So I have a district chef, I have a district marketing person, slightly higher level, and they're looking at leveraging our economies of scale across all 5 campuses. So I think that brings some additional value as well. And long term, the goal is, of course, to be the #1 campus, not just within the Chartwells higher education portfolio, but #1 food service campus in the country. So that's where we're going. Sugarland is in the process of being built. So Sugarland's going to have a convenience store, coffee shop concept, and I think they're breaking ground on that.
Hopefully within the next 3 to 6 months, for sure.
Mm-hmm.
We go with Freshport
Mm-hmm.
for an event that we have, and we want it catered. That's a service.
Mm-hmm.
And all services have to be put on contract. We have to put Freshport on contract in order to get that service.
No, I don't believe so. It's just catering through the university, but we'll double check that and get an answer to send out to the group.
And one thing about the catering, I want to mention, we have an online menu. It captures about maybe 40% of our customers' needs. So always, I encourage you to feel free to call us if you don't see something that you need or you don't see something that fits your budget. Just give us a call and we'll work with it. You can tell us, this is what I've got, I need to feed this many people, and we'll give you some creative solutions, and if you like those, you can hire us. Otherwise, find someone who can, work within your budget, but we're very flexible. Yes, sir. No, Sugarland, I don't think we have any plans for Katy at this point.
Katie's still in the infancy stage, but there will be a vending type concept there right at this moment. But in Sugarland, there will be a Starbucks coffee concept. Yeah.
Any other questions? All right, well, thank you very much for the time.
Thank you all.
Hello. I'm very, very short. Can you hear me? Great. My name is Jamie Gonzalez. I am I know this was already up somewhere, but here we go. Let's see. Did I lose it? Here. Just waiting. So I am the Diversity Education Coordinator for the LGBTQ Resource Center on campus. I usually start my talks with some trivia. So how many universities and colleges are there in the United States? Just a rough guess. I can't hear y'all. Okay, over 4,000. Does anybody know how many LGBTQ resource centers there are on college campuses in the nation? 400 is a guess. Any others? Probably around 250, so less than 10%. So you being here at a university that has an LGBTQ resource center on it is a very unique experience and a great resource. So we just want to make sure that you have an idea of how we can be best serving you as far as education and other services. I also use the pronouns she, her, hers. So some things that we do are we educate faculty, staff, and students about LGBTQ issues on campus and in the community. We support students and staff by providing resources and a sense of community, provide leadership development opportunities for students, and raise awareness by hosting signature events on campus. So education and visibility. When Ruben was talking about stealing an idea for a placard on a door, he's stealing it from us. And this is what our placard looks like. So it used to be, if you've seen the Cougar Ally training, they used to have a rainbow, but branding got onto us, so we have rebranded to this here. And so our Cougar Ally training is a 3-hour training that kind of gives you the basics of LGBTQ issues that your students may be facing, as well as giving you some resources and references to use. So just to be clear, a Cougar Ally is someone with an open mind who's willing to listen non-judgmentally to a student and help make a reference or know a few resources on campus. We do not expect you to be a counselor, an expert, to have all the answers, or to debate on behalf of your student or the community. So just to give you kind of a clear understanding of what that could be. So this is really geared towards our faculty and staff members. So once you complete that 3-hour training, you'll get a placard like this with your name on it to go on your door. If you've already taken the Cougar Ally training in the past, you don't have to retake it to get a new placard. So if you want a new one, which I personally like the old ones better, but if you really, really want a new one, just message us and we can get you one. We also have additional trainings, Ally 2.0 and Trans 101 workshops. So these go a little bit more in depth. And they're not the whole 3 hours, they're 1 hour. This might cover the trans community, non-binary identities, other identities that may not be talked about as often as the lesbian, gay, and bisexual. We have awareness days. We have LGBTQ awareness workshops just for student leaders. So if you advise a student organization, please let them know that they'll get diversity credit for attending. As well as if you identify as LGBTQ or know someone who is and they're really proud and out, they can join our visibility project and be listed on our website. This is great for current students and prospective students to know that there are people on campus like them that they can go and reach out to if they're being rejected by their family, if they've been, they may have been kicked out recently, and so just having you on being out is can make a difference for a student. We also have a lending library with books and DVDs, so come and stop by if that sounds interesting to you. So, support. Some services we have. If you know that you have a student that identifies as transgender and they have a name that they go by that is different than their legal name, they can come and see us and they can have the name on their Cougar card changed. We also have maps of all of the single stall restrooms, so if they feel uncomfortable using the restroom in a gendered restroom, we have that listed on our website. So these are just a few of our services that can make students feel like this is a place where they can be safe. We also have discussion groups that happen monthly on coming out, bisexuality, trans, non-binary identities, and then also an emergency aid. So I think 40% of homeless youth are identified as LGBTQ, and 40% of youth that have committed suicide identified as LGBTQ. So what I'm saying is that this is a population that faces high rejection, and so emergency aid can be really important for these students, especially if they've been kicked out of their homes. So if you know any student that is facing financial difficulties specifically related to being LGBTQ, please send them to us. We will help them get connected in the community, but also try to get them funding to get them through the semester. We do not want these students to drop out. We have an anonymous peer mentoring program as well as various scholarships. Our scholarships are listed under our website under resources. We have some specifically for UH. We have some listed for Houston, Texas, and national. So again, if you have students that are out, please not a lot of people apply to these scholarships, so they have a really good chance of getting it if you give them a push. We have a few leadership opportunities. So again, you know some students who are out and proud and they want to get involved. We have a sexuality and gender acceptance squad. It's really our student ambassadors that we launched last semester. They hosted Moonlight, which is an Oscar-winning film on campus, and over 200 students came, students, faculty, and staff. And they just are in charge of programming and outreach to classrooms as well as staff. We have, again, the mentor program, so a upperclassman can be a mentor to an underclassman. We have a speakers bureau, and these people will stand on our Cougar Allied training panel, or sometimes faculty will reach out to us and ask us to put a panel for their classrooms. So students can be on these, but also staff. So if you have a really powerful story, and maybe that's you're a parent of an LGBTQ student, and you want to talk about your experience as a parent, that can be very valuable. And so we have trainings in a speakers bureau that you can be a part of. We also have other leadership workshops and volunteer opportunities. And finally, our signature events and programs. So we have National Coming Out Day event. This year we brought Pride Portraits. We had 170 faculty, staff, and students participate. My goal was 100, and we had 170. So that was really great to see the community come out and support. We have Coming Out monologues on October 25th. If you value personal stories, or maybe you don't know anybody who's LGBTQ and you just kind of want to know maybe a little bit more about that experience, I highly recommend you come attend. It's on October 25th, and the doors open at 5:45 p.m. in the Student Center South Theater. You can hear students tell their stories about coming out, their experiences, discrimination, success stories. It's very emotional and very powerful. We always host Trans Day of Remembrance for the city on campus at the A.D. Bruce Religion Center, and this year it's on November 18th. And this is to memorialize and remember all of the trans individuals that we have lost nationwide. Gender Infinity happened on campus last semester. It's a conference, and this is to provide education to health providers, counselors, social workers, and educators about gender diverse people. So this might be transgender individuals, non-binary, etc. And so if you need continuing education units or CMEs, this would be a great opportunity to get that on campus. We also have Pride Partners. So like the Cougar Allied training, this is Pride Partners, but this is for a department. So if your department really supports LGBTQ initiatives or you want to learn more about it, you can get a placard for your whole office. The College of Education is one. Our Career Counseling Services is a Pride Partner. So if you think that this is something you'd be interested in or you want to learn more about how your department can be one, please come see me or my director, Lorraine Schrader. We have World AIDS Day on December 1st, this is the first year we're partnering with Wellness to make it AIDS Week, as our World AIDS Week as far as education initiatives on campus. We have Lavender Graduation, an LGBTQ graduation ceremony that we hope that you can come out and support students at in April. And then finally, Houston Pride Parade. So this happens every year in June in Houston. We are not just looking for people who identify as LGBTQ, but really our allies in the community and on campus to come out and say that we're proud to be Cougars and we're proud to support the LGBTQ community. So that is what I have. I know we didn't have I kind of flew through it, but are there any questions that anyone has before? No? Great. And I did bring a few business cards and some of our informational packets, and so if you want to come and get those from me at the end, I am glad to share that information with you. Thank you.
So let's give a round of applause for all of our speakers. And at this time, I would open up the floor to more questions. If you have any other questions for any of our speakers who are still here at this time. Or if there's any other comment or anything that you want to discuss, this is your time to bring it up. If you want to converse or discuss anything. Nay. Y'all just tired, huh? It's like, I'm ready to go eat a little something. Just a reminder, we have a person in the back named Sheila. If you did not get your football ticket at that last Friday, you can see her in the back to get that ticket. If there's nothing else, y'all have any other comments? Neil, you good? I'm trying to find it, wherever it's at. The second one. This? Yes. All right, so here's our pulse poll again. So as you're leaving today, and if you did not do this, please do so we can get that information. And what that is, and I didn't say it, but it's to help us try to figure out what type of topics or interests that if we pull a group together, is not a support group, we don't know what type of group yet, but it's a group that we just say as parenting, that we're going to try to put on once a meeting every other week or so. It could be all parenting. So if people have questions around parenting or resources around how to put a car seat in or daycare or food, whatever, it's a time for staff to come together, be able to talk about those and discuss some of those resources and issues that they may be having and where to go to get that help. So that's why we have this up here. So please, if you haven't done it, go ahead and do that. And we're going to try to implement this pretty soon within the next couple months or so, and then hopefully continue on when we get to the springtime. So if that is it, there's no questions or concern, please go in the back, get your stuff. Sorry, the people who are watching online, you can't have the snacks, but we will eat it all for you. Thank you all for coming to Conversation with Staff, and look forward to seeing you at Focus with Staff in the springtime. So thank you. It's not going to ruin it. You're all good. Great job, you two. Sorry, I should have gave you credit just now. Both of y'all are putting this together.